Hi YouTubers, it's Helen again. I just thought I'd update my video uploads because I've had a couple of appointments at the hospital. A few days ago I went to see my dietitian at my local hospital and she was great. They're always great there. She was pleased with my weight loss and she's pleased with the food intake. I kept a food diary to take in for her, and she was pleased with all the food I've been eating, the nutrition I've been taking in, and particularly my protein, because I'm vegetarian. I find it quite difficult to get enough protein in. And she said that my protein was all fine. I'd had a blood test and the protein and calcium and everything else they test for, all my blood count and everything was all perfect. So far so good. 8 weeks after my operation, I'm looking healthy. I'm going to see her again just before Christmas, and then she said, every 6 months or so I can see her just to keep a check on things, make sure my bloods are all fine. And then yesterday I went to Musgrove Park Hospital in Taunton, which is where I had my surgery, and I saw my surgeon again, Mr. Mann. Very briefly, I went in there, was seen straight away, amazingly enough, no waiting around. You know what hospitals can be like, the waiting times are massive. No waiting around, I got weighed, and they were really pleased with my weight loss. And then I saw my surgeon, who actually didn't, I thought he was going to have a look at my wounds and things like that, and he didn't really. He just basically said, your weight loss is great, do you feel fine? I said yes, and he said that's fine. You'll see the nurse next time you come in 6 months, and then after that you can have telephone consultations once a year really for the rest of my life, just to make sure everything's fine. Then I saw the dietitian there, and the specialist bariatric dietitian, and she, in all truth, wasn't overly helpful. I mean, she wasn't unhelpful, but there was nothing that I didn't learn anything. More actually, I found really that she learnt from me, in that I was telling her things that I'd been eating, things that I couldn't eat, things I'd struggled with, and she was making notes about all of this. And I did point out that the information leaflet that you get after you've had your surgery is pretty woeful, in that it just doesn't contain enough information. You're a little bit lost. You have this surgery that alters your life and you're a little bit lost as to where to go. The most information I've found out is from people on YouTube, other people that have been through it, and I did point that out to her, that I've actually found most of my information from online. And she said that they were producing, they had produced a more comprehensive information booklet, which she gave me, which doesn't look greatly different to me, to be honest. But I know it's a relatively new operation in this country, and they're still learning things, and I suppose in a way we're all still guinea pigs because it's that sort of new, which is fine. It's worked for me, it's worked for thousands of other people, so it's fine. They've got to start somewhere, they've got to learn. A little annoying, I suppose, when you're wanting advice and you're getting vague sorts of answers, I suppose, which that disappointed me. Things like medication, for instance. I've been taking Boots' own children's chewable multivitamins, because Bosper and Taunton both told me that you should take Bassett's soft and chewy multivitamins. Now, I'm vegetarian, like I say, so these are no good for me because they contain gelatin. And also they don't have any thiamine, which is vitamin B1 in it. Now, my sister, who's a pharmacist, sourced some others and found the Boots children's multivitamins, chewable ones. If you take, they're like chalky sorts of things. If you take 2 of them, then they contain enough of the vitamins that you're supposed to have. They include thiamine in them as well, which is something to do with people who are malnourished need extra vitamin B1. You can tell I know very little on the subject. So I wanted to know if I could stop chewing these ones that I'd been taking, and take ones that you can swallow. 8 weeks after my operation, I thought my stomach could probably cope with something that I swallowed. Now, vitamins I know tend to be quite big tablets, so I'd found some that were vegetarian that have got quite small, just from my local pharmacist, and I took them to my dietitian and I showed them to her, and she said that they don't contain any selenium. And you need selenium, which does something to your immune system, boosts your immune system, as far as I understand it. I could be completely wrong, and I'm sure it does other things as well, but I think one of the things it does is boost your immune system. So the tablets I'd just bought didn't have any of that in. Now I've since been to a supermarket and got a separate tablet that's just selenium, just until I get a more complete one. She did say Synatogen A to Z, gold probably. I'm not sure whether she said gold, but the Synatogen A to Z tablets, she said, are their guidelines sort of thing. They sort of contain everything, and that's typical that they're the most expensive ones you can get, isn't it? So I'm going to have a little look around. So I'm not taking loads of tablets because I don't want to swallow loads of things in case it upsets my stomach. I'm going to have a look around, and once I've found something that that contains everything, I'll let you know on YouTube. I'm going to ask my sister, who's a pharmacist, just for her to source it for me, because pharmacists know everything. So yeah, I asked them about that at Taunton to see if I was taking the right things there, and there was just one ingredient missing out as far as you could see. I was taking Zoton fast tabs. Now, when I got my last prescription of them a few days ago, the pharmacist there said to me, "Are you allowed to swallow these tablets yet, or do they have to be in the fast tab form, which is the ones that dissolve in your mouth?" And I said I wasn't sure. I'll ask at Taunton if I can take these ones. The reason being that the fast tabs, the ones that dissolve on your tongue, are very expensive. So in aid to save money, they obviously want you to have the ones that you swallow, which are a lot cheaper. So I asked them at Taunton if I was able to swallow these, and they said they're quite small tablets. You shouldn't have a problem swallowing them. Obviously, if you do, go back to the chewable ones and the dissolvable ones. So I'm just waiting for a prescription to come through for the ones, the Zoton that you can swallow, the tablets you can swallow. I'm just trying to think of the real name, the proper pharmaceutical name of them, and I can't remember now. Lansoprazole. There it is, Lansoprazole. So the brand name is Zoton Fast Tabs, but I need now swallowable Lansoprazole. See my dogs walking around in the back. They want to be on YouTube. And then I'm also taking Calci-Chew D3 Forte. I was taking 2 a day, and I was taking them in the morning because I didn't know any different. On the label it didn't say anything, in the information booklets I hadn't heard any different. But when I saw the dietitian yesterday, she said that she would prefer if they're advising people now to take 1-3 times a day with meals. Once you get to the 8-week stage and you should really be eating 3 meals a day, then they want you to have 1 Calci-Chew with every meal.